Hello, Dr. Neil Baum from New Orleans. Wanting to speak with you about the concept of creating a one-page marketing plan. This is going to be a three-part series, and each of the segments is going to include three elements of the one-page marketing plan. Every industry, including healthcare, has a well thought out plan. However, there are very few of us, and even office managers, who have marketing skills because we don't have any training in marketing and creating a marketing plan. Oftentimes, practices will hire a marketing consultant, but we usually find that those consultants don't live up to the hype that they create regarding their marketing contribution to our practice. This video will cover the one-page marketing plan, which consists of 9 elements. Each video will review 3 elements of the marketing plan. This first video will talk about identifying the target market. This is the one-page marketing plan. It's made up of 3 different components: the before, during, and after. And in this video, I'm going to cover part 1, which will be the first component. And this will be how to identify your target market and communicate with that target market. I suggest the PVP approach, and that is find out what you like to do, find out the value that you bring, and certainly make sure it is profitable. First of all, you want to find out what you enjoy doing. What patients do you enjoy treating? You need to find your niche and your unique service proposition. If you're in primary care, it could be obesity. If you're an orthopedist, it could be sports medicine. If you're a urologist, it could be benign prostate enlargement or erectile dysfunction. Next, you have to look at the value that you bring. 3 examples would be a OB/GYN or IVF facility helping women achieve pregnancy. If you're a urologist, helping men achieve an erection. If you're in primary care, it might be helping hypertensive patients achieve normal blood pressures. And finally, that the PVP acronym, the P stands for profitability. You want to make sure what you're targeting is going to bring a return on your investment. The second element of the before proposal is your message to your target market. Most messages are boring and me too. They're the same as every other practice that is reaching out, trying to attract patients in your region or community. And this is a waste of your precious marketing dollars. I think you have to define and find your unique service proposition and answer the question, what makes you different and special, and how do you distinguish yourself from others in the community? You want to find the patients that you enjoy caring for and the ones that you are trained to care for. And that means identifying the sweet spot, what patients want and what you do well. An example of a unique selling proposition is the commodity water. Tap water is abundant and it's virtually free from the tap. Yet millions of people will spend $2 a bottle for a liter of bottled water. The facts are that the cost that they are paying for that liter of bottled water is 20% more than a bottle of beer, 40% more than the same volume of milk, and 3 times more costly than a liter of gasoline. So what can you do to motivate others to pay more for water than what is free at the tap? You have to identify your unique service proposition and what can you do to become the Evian of healthcare. So what do you have to do? You have to look at your brand, look at your online reviews. How long does it take a patient to make an appointment? How long did the patient remain in the reception area or the exam room before seeing a doctor? Did the office or the doctor return calls in a timely fashion? And most important of all, did each and every patient have a positive experience every time they interacted with the practice or the doctor? My take-home message is you need to think out and identify why would a potential patient prefer your practice rather than that of a competitor. It's of interest that most patients learn about your unique service proposition after they enter into your practice. What I hope to emphasize in this video is you want to make your U.S.P attractive to patients before they enter your practice. The third element of this video is selecting the media of communication. You want to find out how to use today's social media to reach out to potential patients. Technology is available that you can measure the effectiveness of social media and your reach to your target patients. This is often difficult to be done in a small and medium-sized urology practice with available staff. You need a marketing expert to help you identify the use of websites, social media, direct mail, or even conventional practice promotion such as TV and newspaper. I want to emphasize that you need to shift from a Me Too that is the shotgun approach that targets everybody to a target approach that identifies the patients that you enjoy treating. So the bottom line, in summary, is to identify the target market you're trying to reach, and then create that marketing message to reach those targeted patients. And finally, select the media vehicle to reach your target market. I hope you have found this segment on the first phase of creating a one-page marketing plan useful. If you would like a copy of the one-page marketing plan, kindly contact me at the email address shown on this last slide. Thank you.